There's nothing else.
You got one more? Go. Alright.
This one's right
Would you mind doing a recording for us when we get started? Once our camera goes in, you can record. Ah. Yes, it's phone now. Yeah, yeah. So when we.
Sorry. You have to leave my turn. Okay.
get the bed down and
This is our cute girl.
I'm sorry, Ash, you can keep the bed up.
It's all prepped. Okay. Alright, yes, and we'll take the bed down.
Robotic, yes. Robotic, you want something to have the place? Okay.
Okay, we'll take our cords. And we'll take our gas one too.
Alright.
We'll pass it all together. We'll take our camera as well. It's right there. Thank you.
Later. Alright, there we have
Make sure that gets as well. Okay. We're ready for a timeout whenever you are.
Any PA?
We're doing a robotic cholecystectomy.
no eligibility allowed to give you MCAT right now. Without a concern. OTR done on September.
And did you get subking heparin?
We don't have that. Do you want it?
Yes, please.
You have 25,000.
Yep. Anything else?
Any other concerns?
Okay, excellent. Thank you. Let's go ahead and grab the little bowl. That goes to you. I'm going to say your introduction. And it's going to be fine. So,
One thing that welcome to the world.
Yep. Stretching. And just a couple of That's good. We'll take a knife, please. That's just a puncture for the bears. Getting this back. Bears, please.
And you have the setting
Thank you. Control there. You're feeling for 3 pops. Which is 1, 2, 3.
You can get the gas one.
There you go. There you go. That cheek hand. Cheek touch. And you can go to 40 as well. Perfect. Nice and done. Okay, let's mark ourselves out. So grab a marking pen. Cool. And Abid, do you want to tell me where you want to go? remember we're doing our body. So we're skewing over to here. And then this one's going to be somewhere around here so that it can lift as our progress towards our gallbladder. Mm-hmm. Yeah. Lower is better. Yeah. Okay. Cool. Yeah. Because basically you always want to target your gallbladder and give yourself space with your tools. You don't want to go too high, but you also don't want to be below the dome, like of the abdomen. So as we go in, we may adjust that a little bit. You don't want to be underneath your horizon, right?
Or definitely, yeah. Visualization is much better. So we can get local also.
Just like local?
And inject, how much do we have?
How much lighter can the epic penetration?
How much do we have on the field?
I have
20? 40?
Yeah.
Okay, so do the rest of this here and then 10. And just one injection, good? Make that injection really count. There you go. All right, take 10 more, please. 10 more.
I thought that's what I thought.
If you want to give us the bigger syringe, that would be okay.
Okay. Yeah,
Yep.
I did.
We also can do a tap water if you want, but we'll do a tap water. Is that 20?
No, this is 30.
30? Oh, the rest of you. Even better. More, yeah, there you go. There's a lot of motion going on with your needle, but it doesn't really to you.
Just inject. It's gonna come through.
And do about 10. In general, we want to be really efficient with our motion. So one motion instead of 3. Okay. And you may want to. She does have a little watermelon belly. There you go. She looked kind of skinny when we were, I guess, in my world. It's all relative. These are all skinny patients. Skinny. We're good and skinny. Alrighty, and when we're at 15, which we definitely are, and always look here, yes, but also take a good visual of your actual. Does this look insufflated to you? Yes, okay. So we'll go ahead and take a knife next, please. It'll go, yeah, go on this side. Very good. Go ahead and take that. You're going to make an 8 here. We'll take an 8 quart, please. Go through the dermis. Yeah. Good, okay, perfect. You can go ahead and drop it here.
Do you want to make all the things or? And then just do it based off of the.
So, like a gun. The reason why is because even if I stab this in, the furthest I'm going is my finger. If I leave it like this, look at that, totally different, right? So like a gun, you go in, as you go in blind, you do a lot more rotation than you do push. And at times, you can actually pull back to reduce the pressure, okay? As you do this, always confirm that you're at 15 per pressure.
That's good. Thank you.
Yeah. Good. And get right over it. So be very comfortable as you do this rotation more than push. Good. That's it. That's enough. That's enough. That's good. Go ahead and take this out. Good. Let's get our camera. One minute. Turn on right on. And always make sure that your bunny ears are in line with the arm. Cool. And then go ahead and take it away. It's not going
We can get the bed down as well.
By the way,
Yeah. And the lights.
on the light.
Turn the light on.
I made it hard on you.
Perfect.
Good job. Let's take a look at our varus first.
Just be careful with the wire. It's dropping kind of low. There you go.
Good. Okay. Let's take our varus off. So varus will come out. Very good. We can go ahead and start recording. Varus coming up.
And you can get the knife.
And then, Abed, as you do this, take a look and make sure you still want your You're doing this, do not worry. Keep those in mind. Keep those in mind. Yeah, I still think that's a good location. What do you think? And again, you want to give yourself more space rather than less, so that you're on the side that's going too low rather than too high. And you can make all the bits. Keep it very nice spot. So you can pull your port back a little bit too. Remember, you can pull your port back a little bit over the camera. That's good. Try to keep your horizon level.
So that's why I'm looking to do that, but if you want to be more fully.
Good. Alright, and we'll take 8, 8, 8. After this. Yep. Now it's left-handed, so it's yep. Make sure we get that black and flash up. Make sure your tort's not moving. Okay, great. Can you down the camera from here?
Residents.
Again, try to
So,
and Abed, if anywhere you're
the way it's called, yeah, it's six now, I want to do.
like butter, right? Oh, this roll.
Bad time to start.
I mean,
Better.
alright, and then we're gonna hand over the camera to Abed, so you can take away your side and make sure that works in good position.
So what we're thinking is, okay, let's see if we can really high. Not because it's okay, it's not but there's
There's just a little bit in to get that black and flash.
Yes.
One last thing.
pretty well.
Where raise the Can we go ahead and put her in 20 degrees of reverse conjunction? We'll let you know when she's about there. Okay. And then we are ready for our robot to come in.
No, when we dock it, I'll stick it in for you because when it gets too hot, we get the alarm. Don't forget the thing. When it gets too hot,
We're all ears. Shut up. A little more. Yeah, and this should help. A little bit more. Very good. Is she having airway issues? That's great. And then if you can pull back your port line.
We do.
Great. You should have space if you don't want to. And then we'll take this light out here. And we can take this out. And guys, if you can pull that light back a little bit further towards here. Just to get that fully out. Perfect. That's great. And is she doing okay airway-wise or?
It's okay now, the peak was high when we got into the shelf
Okay.
so we're just doing a mass sample with
Trying to leave the line to the endoscope
If you
port.
have issues, just let me know. We
Yeah.
can drop the pressure.
Yeah.
But right now we're at 14.
Yeah, and she's looking on us. So she's still a little high, but she's still okay.
Okay. And remember to guide her in as you go. Good.
Is it too high?
So I'm going to point it out to her with your finger.
And then to the next.
Just stand right here.
And we're targeting which port? Maybe.
A little bit further. And then just a little to the right. Yep, perfect. That's it.
Okay.
Thank you.
And I'll be using your arms. Significantly more, like you can Ellen. Okay.
so let's turn this around so we don't lose it, okay?
You got like the best tech, the best string.
Thanks.
Obviously, Sydney goes without saying. Okay. And let's work that slightly to make sure that we're not on tension on the abdominal wall. So you see that divot that it creates? You want to get, so basically, tension. So you kind of want to relieve that pressure as much as possible. Make sense? Okay. And then now,
That does.
And maybe right there. Right there is good for you.
and we'll grab a hook. We'll grab a cardio and we'll grab a hook.
No, this is programmed.
You suck.
And Abby, can you move your arms out so they're straight, please? And can you show me a little bit of Okay, remember, yeah, so we're going to So remember, this is the thing. Here, we're about. What do you want? What do you want? Two options. The rest of the book. What goes here? Remember to load your pottery onto them slowly. Very good.
Do you mind if it, do you like the disposable products on the same, or do you like the reusable?
Doesn't matter.
Doesn't matter? Okay.
Either one is fine.
Okay.
Yep. Whatever's harder for the residents to use.
Oh, because we have one that comes in a tray, that's why I was
Gotcha.
asking.
Oh yeah, either one is totally fine.
Okay.
Okay. Very good. And as we're guiding our instruments in,
How was it, right? I'm not gonna
nicely done, Abid. That was really nice. Can we make sure that we're loaded onto our hook with pottery, please? And remember, it's blue bipolar, green is the other one. Wonderful. Great. Very nicely done, crew. That was very smooth. And remember, if you don't mind to loop that through. Loop the green part through the hook, just like you do with camera. Yep, there you go. All right, good job, guys. Nice. Okay, I'm scrubbing out. Abid, come here. And then, yeah.
Oh, yeah, this is